I think one of the things that stuck out for me when my doctor initially brought it up was injection. So she actually had a trainer device that she gave me. The trainer device, I was able to hold it in my hand, look at it. We were able to, play around with it, and she showed me how it would work. So she walked me through that process, and then we kind of talked through the first injection, which I actually did myself while she was watching. So I was very comfortable with moving forward, taking it at home by myself. With this and other things, I think the very first time when you don't know what to expect, you can be afraid. And it's okay to be afraid, but as time goes on, as you get comfortable, you realize, it's not as scary as you once thought.
Indications. What is TREMFYA, guselkumab? TREMFYA is a prescription medicine used to treat adults and children 6 years and older who also weigh at least 88 pounds, 40 kilograms, with moderate to severe plaque psoriasis, who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light. TREMFYA is a prescription medicine used to treat adults and children 6 years and older who also weigh at least 88 pounds, 40 kilograms, with active psoriatic arthritis. Important safety information. What is the most important information I should know about TREMFYA? TREMFYA is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using TREMFYA and get emergency medical help right away if you develop any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. TREMFYA may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with TREMFYA, and may treat you for TB before you begin treatment with TREMFYA if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with TREMFYA. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, muscle aches, weight loss, cough, warm, red, or painful skin or sores on your body different from your psoriasis, diarrhea or stomach pain, shortness of breath, blood in your phlegm, mucus, burning when you urinate or urinating more often than normal. Liver problems. With the treatment of plaque psoriasis or psoriatic arthritis, your healthcare provider may do blood tests to check your liver before and, as necessary, during treatment with TREMFYA. Your healthcare provider may stop treatment with TREMFYA if you develop liver problems. Tell your healthcare provider right away if you notice any of the following symptoms: unexplained rash, vomiting, tiredness, fatigue, yellowing of the skin or the whites of your eyes, nausea, stomach pain, abdominal, loss of appetite, dark urine. Do not use TREMFYA if you have had a serious allergic reaction to guselkumab or any of the ingredients in TREMFYA. Before using TREMFYA, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about TREMFYA?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. You should avoid receiving live vaccines during treatment with TREMFYA. Children should be brought up to date with all vaccines before starting TREMFYA. Are pregnant or plan to become pregnant. It is not known if TREMFYA can harm your unborn baby. Pregnancy registry. If you become pregnant during treatment with TREMFYA, talk to your healthcare provider about registering in the Pregnancy Exposure Registry for TREMFYA. You can enroll by visiting www.mother2baby.org/ongoing-study/TREMFYA-guselkumab by calling 1-877-311-8972 or emailing mother2baby@health.ucsd.edu. The purpose of this registry is to collect information about the safety of TREMFYA during pregnancy. Are breastfeeding or plan to breastfeed? It is not known if TREMFYA passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TREMFYA? TREMFYA may cause serious side effects. See, what is the most important information I should know about TREMFYA? The most common side effects of TREMFYA include respiratory tract infections, headache, injection site reactions, joint pain, arthralgia, diarrhea, stomach flu, gastroenteritis, fungal skin infections, herpes simplex infections, stomach pain, bronchitis, feeling very tired, fatigue, fever, pyrexia, and skin rash. These are not all the possible side effects of TREMFYA. Call your doctor for medical advice about side effects. Use TREMFYA exactly as your healthcare provider tells you to use it. Please read the full prescribing information, including medication guide for TREMFYA, and discuss any questions that you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. TREMFYA is available as a 100 milligrams per milliliter subcutaneous injection.